One of the most important skills I have learned in content creation is the phrase, I'm telling you this because. It's always been the magic trick that started me connecting facts into meaningful stories. And it's always had me thinking about how what I do and what I'm creating actually relates to the audience, not just myself. Today, we have Lea Brainerd from Mindbloom, a recently legalized psychedelic therapy that you can do at home. Now, you might be asking, Ethan, why are you telling me about all this stuff? Well, I'm telling you this because this experiences I had with Mindbloom are exactly how I learned to use that phrase. So, Lea, I'm really excited to have you on the show today.
Thank you for having me. And just FYI, it's Lea Brainerd.
Lea Brainerd. Man, I should have checked that first.
It's okay.
Rookie
My
mistake
first
number
grade
one.
teacher called me that. So it's, familiar.
Thanks, Lea.
No problem.
So can you tell us a little bit about, how we know each other, how we met?
Yeah, absolutely. As long as you're okay with it, Ethan. You give consent. Okay, perfect. So I met Ethan working with Mindbloom. It's a company I do contract work for, and they provide at-home ketamine therapy. So Ethan is one of my clients, and we really connected and just really enjoy seeing his growth in this process. And, I've shared my own experience with ketamine treatments as well. So really, really excited to be on this podcast and appreciate you asking me.
I think this is going to be really great for me and the audience, and maybe even Ryan a little bit. He's a patient guy.
I look forward to learning because this is something that we're talking about where I have no experience, no idea what's going on. I am extremely ignorant on everything about this. So I'm excited to learn.
That's perfect.
I really do feel that this has been a major help in all the content creation stuff that I've done. We talk about skills with the camera, but then we get into writing and what kind of stuff you can make. And a lot of this comes down to fundamental, mental, emotional inspiration stuff. And this has been a huge help. So we mentioned last episode that, not going to go off on that side tangent, but I got this from working with Mindbloom and been really wanting to take time to actually dive into that. Working there, can you tell us exactly what your role is? Are you a therapist, a pharmacologist? Tell me about what you do.
Sure. So I'm a psychiatric clinician is the term that they use. So basically a medical provider. And I do assessments and determine if patients or clients are appropriate for treatment. I started with them 2 years ago, and it was funny because I was actually looking up ketamine treatments for myself. And, saw how expensive the IV treatments were in the clinics that were around me, and came across Mindbloom and saw that they were hiring. At that point, I was in my first job as a PA and just really miserable, on call every 3 weeks, working at an inpatient treatment center. I applied and they said, we need you to have a little bit more experience. So apply in 3 months. And I did. And so I've been with them for almost exactly 2 years, to the date, and it's been an incredible experience, really being able to offer an alternative treatment for people that struggle with depression and anxiety, because what we have out there right now, let's just be honest, it does not really work. It covers up symptoms. It doesn't get to the root of the problem, and that's what I really find extremely fascinating about ketamine.
So primarily it's marketed and designed and legalized for anxiety and depression. Is that right?
That's right. It's also used, it's off label for anxiety and depression, but other diagnoses that includes PTSD, OCD, borderline personality disorder. Not really official, but it's also extremely helpful for addiction, different addictive patterns, just depending on where the client shows up in the process. If you need to go to detox, ketamine's not appropriate at that point. But blanketly anxiety and depression and some disorders that fall within that.
Now, this just give a roadmap of what we're talking about today. That stuff, I've read so much of how it works, and my experiences, I could see so much of how that is useful. And I definitely want to get into more of the whole roadmap of Mindbloom and ketamine therapy. For me, how I connect to the content creation we're doing, I've definitely had some very grueling experiences in my life. And at this point, I'd already sorted those out. A lot of the stuff I started out was actually years of this podcast, which used to be called the Ben and Charlie podcast, and now is the Dropping In with Charlie Hooper podcast. And they talked so much about psychedelic therapy that they kept on saying, like, well, you should do MDMA therapy if you can, but if you can't, ketamine therapy is getting legalized. And it was kind of this, well, I'm not really sure. I wish I had that, when I was going through my rough stuff in life, but I've developed so much, especially, professionally, personally, and, artistically from these guys. Like, let's try what they have.
Mhm.
And it turned out to have so many benefits, for expanding my life. One thing I think is worth addressing is, are we only focused on repairing people, or do we have an interest in enhancing people?
Oh,
And for me, it was a whole lot of enhancing.
yeah. 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 A whole lot of enhancing. And that comes with it. It's interesting. I'll have a lot of people. One of the groups that I work with, they are breathwork practitioners and do a lot of meditation and follow Dr. Joe Dispenza. I don't know if you guys have heard of his work. But really, typically struggling with some trauma or anxiety or depression and have those symptoms. Of course, you have to have that to be able to be prescribed it, right? But another piece that they're really looking for is that deepening of their meditation, kind of the spiritual experience, expanding their spirituality and their connection with the universe. And I find it very, very interesting. I've had a couple times where I've interviewed people, they don't really have any anxiety or depression, but they want to expand. And there's a big part of me, I'm like, why not? Why will we not want to make people that are, generally mentally healthy expand even more, right? But that's not where we are in terms of how we are supposed to prescribe it. So
Yeah.
yeah,
I feel like in the beginning of my process, there was a couple of conversations where a little bit like, why is this guy wasting my time? But everyone was super nice to me anyway, and I'm so glad they did.
With us, me and you.
No. Like, just in general process, we're like, oh, this is nice. And there's so, can we help you with this? Like, oh yeah, you were fine. Like, okay, we'll just go with the ride.
Mm-hmm. Yep.
So to get us started, could you tell us a story of, as much as you're allowed, experience you had a patient with that really stood out with your experience?
Mm. You asked me to think of one earlier, and there's so many patients that I've worked with that stand out. But the one that just came into my mind to tell is a guy who was in the police force, was involved in a shooting incident. I can't recall if somebody died. I think he may have shot somebody in the line of action, and had a lot of PTSD. Just a lot. Was really in a dark place whenever I first saw him. And it's really cool when I have the patients that after one session, it's just like that right neural pathway clicked in, and that happened for him. He said, I feel like I did 20 years ago before I was ever in the police force. It's like it just processed and wiped away just years of gunk that has been stuck in me, and just seeing the growth in him. And he's really big on wanting to share his experience and sharing it with a whole lot of other people, and brought in several people to Mindbloom, and just continues to do really great. He actually texted me the other day, and he'll send me ketamine playlists, music that he listens to during it. And yeah, just so countless. I've seen over 1,000 clients through this process, and just that's what gets me going is seeing their experiences and how much better they do, and just how grateful they are. I'm like, I'm not doing anything. I'm just the drug dealer. I'm just prescribing the drug. But a big part of how I work with people is I'm a counselor at heart. I probably was meant to be a therapist, but they unfortunately don't make enough money, and can therapize a little bit as a PA. So I would say that's one that really has stood out to me.
So we're going to want to understand. Oh, go ahead, Ryan.
Just a quick question, and both of you can probably speak to this. Could you talk to me what the process looks like and it's amazing that you saw results that quickly. Is that a normal thing, or is that he was just really open to it and the ideal?
Yeah. Great question. That is not the norm. And oftentimes that is the story that gets told to people or, shared on the internet, and people will read about stories. And, that's a big piece of the ketamine experience, is like not comparing your experience to others, to really honor your own journey. Cause we're all coming to this place, with different, past, different traumas, different disorders, different life circumstances. So, that's a really positive experience to have that much change and improvement after one. Typically it's 4, which is not that much more. So typically in Mindbloom, one of the largest studies that's been done with the sublingual ketamine, which is what Mindbloom uses.
Sublingual?
Yes. Yeah. The sublingual oral, where you dissolve it and it absorbs. Yeah. So 89% of people showed improvement in their symptoms after just 4 sessions. And I think it was like 33% had virtually no symptoms at all. Just, were, cured, quote unquote cured. You're never really cured, but just no symptoms from when they started. And that's just 4. And the typical.
That's amazing.
Yeah, it's amazing. It really, I mean, you don't see that with any other medication, any other treatment for mental health. But a typical session package is a total of 6 sessions. So in the initial sessions, you're doing them more close together, like every 3 to 7 days. And, a lot of times that's all people will need. Now, there are some people with really severe treatment resistant depression or, severe PTSD, that 6 is not enough to really get them to where they want to be. And, myself included, I'm big on self-disclosure, appropriate self-disclosure. And that's one thing that I have found. It's just like my clients will relax immediately when I share with them, and I share with everyone I see. I believe in ketamine. I've seen it help most people I see in some way, including myself, and it's just like, oh, okay. So she actually has done this, and I can really trust her more, because she's not just somebody in a white coat that's just zipped up and. So yeah, some people will continue on, do treatment renewal or booster sessions where, you do them a little less often. And typically people don't do these longer than 3 years. 3 years is the mark where you would want to be like, okay, how often are we doing these? You want to make sure you're not dependent on it to feel better, because the ultimate goal in somebody that was really trying to help people is to not have to do these forever, right?
Yeah.
To get to the point where you're okay. Thank you, ketamine. You served me well, and I don't need you anymore. It's possible. It's possible to do that. You don't have to be on an antidepressant every day for the rest of your life. That's not even how they're meant to be prescribed. It's supposed to be short term, but so many people are on it for years and years and years. So, amazing experiences and growth and change that I've seen in people. It's astounding to me. Every day I'm just surprised when I hear, the results that people are having.
Definitely.
Great.
That will definitely appeal for me, where it's something where it does it and it's done. It's not like you need to have this medicine forever. You're like in an altered state forever. It's just, it's like, going to college. You get some knowledge. It's useful, and you have that forever. It's just, part of you now.
Mm-hmm. Absolutely.
Can we walk a little bit through the tangible parts of the process? So, how does the actual sessions work? Because there's a big mix of the actual ketamine, but that's not the whole thing. I would actually even say that the ketamine itself is less than half of the entire importance.
Yeah, very true. Less than half. And the other, 60% is the integration of the experiences. So
Why don't you tell us what happens before they get the medicine, and what happens during the medicine and then after?
Yeah, absolutely. And I'll speak kind of to what Mindbloom does. I also have my own private practice as well, and I do it pretty similar since I learned from Mindbloom. So when you go to sign up, like on Mindbloom, it asks you some questions. So basically trying to rule out any medical issues that could cause you to not be a candidate for ketamine. And then we'll ask you about your symptoms that you're experiencing. And it's like, okay, yeah, this could be an option for you. And then you got to sign up, get an appointment with a clinician. And we do a full evaluation, medical history, get a full medical history, do a psychiatric evaluation, and determine the diagnosis and see if they're a good fit. The thing about ketamine, most people, even with like severe disorders, a lot of times you're going to qualify for it unless you have a history of psychosis, if you have bipolar 1 disorder, if you have, severe uncontrolled medical issues, heart, kidney, anything like that. Thyroid is a big one. So really we're just trying to look at and make sure it's appropriate and healthy for people to try it. And then once they're approved, we send them the treatments, and we always start out at a weight-based dose. So it's typically more mild than where we're going to get you to be, because you got to make sure you tolerate it okay, normal to be.
So it comes in the mail.
It does. It comes in the mail. So it's mail order. And that's how I do it with my private practice as well. It's been interesting to try to find pharmacies that will compound the ketamine.
That's an interesting part of this.
Yeah. So once Mindbloom sends it out, we send out 6 treatments at the initial starting dose, and then you're evaluated kind of asynchronously on your first session. Determine that second dose, and then I meet with them after their second session to see how it's going. We'll send, anything for what their dose is increasing to, if it is. And then that's basically it. They can always check in with me. That's the piece where like the counselor part of me, and like, I want to be a part of the whole process. But how Mindbloom does it is they have integration coaches. So they're oftentimes like life coaches or meditation practitioners, things like that. They're not therapists. But they will meet with the client on the first time that they take the treatment on Zoom, before and after. So they walk through how to take the medicine again, make sure they have everything in place. Everybody needs to have a chaperone with them, to hold space there. And then they'll have their first session. They'll get on and talk to the guide, and then they'll have their guide throughout the whole process. They have unlimited messaging with them. They have integration sessions with them. One thing I love about Mindbloom is their app is bomb. Like they have it going on with the app. They have, especially curated music. They have various pathways focused on particular topics. So like the one that I'm personally going through is called Beating Burnout. You guys were talking about burnout.
I'm going to be doing that one next.
Yeah, it's a good one. It's a really good one. But they have, anxiety, depression, one focused on repairing trust and intimacy. There's just a variety of pathways and different integration materials on there. And yeah, they've really got it going on with that. There are some clients that, depending on their trauma, if they process it or not, some people are going to have a therapist as well. So that's one thing that I also determine, like, is it okay for you to just work with the integration coach, or do you need a therapist that you're working with on an individual basis, more frequently to move through this? Because one thing that ketamine does is bring up all the things that we have stuffed down, in the past. And so it'll start to bring that up. And if you don't have a safe container to process that with somebody, that can be not good. And I think that's sometimes where people will fall off, because it gets too hard. It gets too hard to do it on their own.
The metaphor I like to explain it, it's kind of like if you had like a tumor inside you, you'd have to go to surgery to have it removed, but that's still a very dangerous thing, and you need to be healthy enough or have enough support around you that you could heal after it. So you got to look out for that.
That's a great metaphor. Yeah, I love that. That's fun. Yeah.
I wanted to dive a little bit more detail into this. So you're mentioning these different pathways. As I understand it, like a beginner, they'll be starting on a 6, the 6-pack of kind of like a general thing. And then after that, they would go on to another pathway that's a more detail.
That's right. Yep, exactly.
Could we first talk about like in detail what an exact session is like, and then talk about the general pathway that you start off on for a beginner?
Sure. So the general pathway is like an introduction session. Does it have any specific topic or whatever? Just really an introduction to the medicine.
There's so much to it.
I know, right? I know.
Yeah.
So the session experience itself, what we're going for is to reach a state like a deep meditation or a dream-like trance state. where you have a degree of awareness and control, but can let go of some of those ego defenses, quiet the mind, and just really see things from a different perspective. So
Hmm.
ketamine alters your senses. So physical sensations could feel like really heavy or floaty. Visual experiences, shapes, colors can be anywhere from that to very detailed, visuals, either in your mind's eye or you're actually like opening your eyes with the mask and you can kind of see some visuals going on. Um,
So you're lying in bed with a mask on for the time.
yes, yes. And you don't have, it's not like you have visuals like psilocybin, where if you took your mask off, you're going to be seeing things like swirling or moving around. It's not really like that, which I find very interesting. So visuals, different types of thoughts. So it really puts you in that objective frame of mind where you're able to observe your thoughts
Hmm.
and not have that emotional attachment to it. So it helps to separate thoughts and emotions. And then it can also bring up emotions. So especially for people that have been emotionally repressed, you can start to feel some emotions that you haven't felt in a long time and really connect with those. You can be told something over and over and over, and know it, but until you
Hmm.
feel it's not ever going to click. And that is one thing that ketamine does so beautifully, is help people actually feel things and then it clicks. It's
Hmm.
oftentimes the insights people get are very simple and things that we've heard over and over, growing up, like balance, being present. It seems very simple, but it's really not until you understand what that really means.
Yeah.
Um,
Like that is one spot where I really felt the strong connection to like artistic stuff and content creation and all that. Where for me, I was going through and I could feel like someone else that I know, they're doing this thing or that thing. And I know mentally, well, they can't help it because they've had this experience to them. But it's a thought, not a feeling. But going through that first session, like I can feel how if I had lived that life, I would feel the exact same way and do the exact same thing that they're doing. And for, making peace with emotions, that's very helpful. But for, writing and story like this stuff, I had that emotional connection now of this is how someone in that realm feels. So it's a lot easier for me to say if I was going to write an advertisement or a story for someone like that, I have more of a connection to that. I can relate to that and actually write it. If I wanted to make a story with a character like that person, it wouldn't just be a two-dimensional person. I can sort of emotionally, like, this is how I would react if I was that person. And it opens so many more doors for that kind of work as well.
It really does. I mean, the emotional intelligence, that increases after it. I mean, it enhances people's lives in so many ways, especially in work and career and being creative, tapping into that right side of the brain, which we're in such a left brain society,
Mm.
I think this is just it's so important to do to find that other part of us that we push down and ignore because we're trying to live our lives and get everything done and check all the boxes and be very action oriented. And it's like, yeah, how's that working for you? You know?
So how
Uh,
long does a session take? Because I know I hear the most thing I hear is like people going down to Latin America and having a 3-day retreat. How long does a session last?
so use depending on the form used. So sublingual, the oral form, is about an hour long session. May feel kind of a little off balance, a little kind of in your head, but
Hmm.
after about 3 hours, you're back to your normal physically and mentally. So it's not like other psychedelics that last 12 hours. It's like once you're in it, you're in it for a long time, and there's no getting out of it. It makes it a lot more doable to fit into your life, especially with the at-home ketamine therapy. You technically could do a session in the morning and not driving, because we say don't drive until you've slept, but then go to a restaurant that afternoon with your boyfriend or whatever. So I think that makes it really unique, like the kind of
Mm.
more short-lived experience. It's more, yeah, people are actually able to fit it into their lives instead of going to ayahuasca retreat down in Costa
Yeah.
Rica, which are awesome, but not for a lot of people.
It feels like a high ratio of time to think about the experience. So, like at least in my experience, I felt like the medicine's doing a whole lot, but the amount of time you actually have to think about what happened and just your normal self is putting together so many benefits.
Absolutely. That's why we say after a session, journal, journal in some way,
Hmm.
shape, or form, write audio journal. I'm a big voice memo person, so I oftentimes
Oh,
just
that's a
like
great
talk
idea.
after my treatment. And it's so important. One thing that will happen, that has been happening before all these at-home ketamine therapies and the different formulations, when people go into IV clinics, and most ketamine clinics around don't provide any integration, don't provide any therapy. You're purely getting the benefit of the medicine, which is great. But if you don't know how to integrate those experiences in your life, because integration is really getting down to the core problems or what causing
Mm,
your symptoms, and that's important. Otherwise, it's just going to flare back up. So the one thing with ketamine is the transient effects of it, but how you mitigate that and lessen the number of treatments that you need and really extend those results is integrating your experiences in your life. So I always say
what
do
does
something for
integration
your
look like?
good question. So integration can look very different. So I always say do something for your mind, your body, and your spirit. So for your mind, a great one is journaling. For
Hmm.
your body, breath work. That's been something that I've gotten into with the ketamine treatments. Very helpful. Yoga, going for a nature walk. I mean, exercise if you're being very intentional about it. And then, something for your spirit. So meditation. Um, or prayer or positive affirmations, anything like that. So really it's taking the meaning of the session, which there may or may not be a meaning or an insight that you get, but it's a lot of symbolism. And for
Mm,
one, will always look up the symbolism of things that I see, and it, most of the time will have some relevance to what I'm trying to work through. So when you go into a session, it's always important to have some kind of intention. It can be as specific as you want it to be, or it can be just more general. But having that
yeah.
intention, having the session, and then really just reflecting on your experience, and then paying attention to how you feel afterward. I think one of the first things that this does is increase self-awareness, because a lot of us are just, poorly self-aware. And it helps you have that space in between a reaction. If you're triggered by somebody, or you feel that anger come up, it's like before I snap off, I have a minute in my head and I'm like, "Ooh, okay, that just triggered me. Oh, that's interesting. I really just want to yell at this person." But you're having
Hmm.
this internal dialogue in your head. Well, that's not going to be helpful if I yell at this person. So let me just recognize that I'm angry right now, and form a more appropriate response. So that
Yeah,
space in
yeah.
between that response time and that awareness is one of the first things that will happen with people.
I was shocked at how much that happened. I
Interesting.
remember one day, like clear as a bell, I was talking with one of my friends who, like, I know we're good friends, and he was getting really just like mad and bitchy and all that stuff. And I was telling him about something I was really excited about. He just like got furious at me, and there wasn't the big thing of having a blowout and then realizing, oh, he's my friend, and talk it out, and then we'll like patch up. It was just instantaneous, like immediate. This guy is my friend. There's got to be something stressing him out. This is not really him. And I just
Mhm.
gave him about like 30 seconds, like, so. And he just had time for his emotion to vent out and look like, yeah, I'm sorry. I'm pissed about this other stuff. It actually has nothing to do with what you said. Like, yeah, that's just cool. Like, can I vent my thing and we'll come back and talk about your topic again? And it was just like, one, it saved us like hours of wasted time arguing. But like, it was fun. I actually got to like know more about like what is the real thing that's stressing you out, man. So
Mhm.
such tangible benefits.
Absolutely.
Could I ask you to like back up and go into like the sandwich of the intention and then the medicine for the session and the integration after? Because like the medicine is the only topic that really gets a lot of attention in most places, and you have a lot of special knowledge on this. The system of how you develop intentions, it's its own skill, and you get a lot of help from people like you doing that.
Absolutely. Yeah. Intentions are just so important. And basically it's goals. What are you wanting to get out of the treatment? And I think a
Mm.
good practice is before you even start is to journal about that. Like after you learn about ketamine and how it can help, okay, what am I wanting to get out of this? What are the parts of my life that I want to improve or change or grow, or the parts of myself that I want to grow?
So you think about
And
one for each session you have.
Absolutely, absolutely. And you can just kind of like make a list and I'm like, okay, that's a lot. But you want to make sure to just be kind of very focused. I remember the first few treatments that I did, I was like, all right, let's go. I'm going to heal my trauma, heal my anxiety. I'm going to heal, it was like, I'm going to do all of these things in this one session. Like, no, girl, that is not going to happen. So, just understanding, and a lot of people can really get that false sense of, oh, this is going to cure me. Like in 6 treatments, I'm about to get all of this done. And that's just not how healing works. It's always an up and down. And the whole point of ketamine is to try to lessen the triggers, lessen the intensity of the symptoms, and, really increase your coping skills and ability to deal with them. So an intention, one thing I'll tell people often is if you're not sure, think of show me, teach me, heal me, and you can say, show me, da, 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 da. So that's a good practice to do. And you always want to form intentions, which a lot of people don't know this, in a positive affirmation. So you can't that's how our brain works. Our brain does not really work on negation. So if you want to say, I don't want to be depressed anymore. No, we gotta kind of
what you do want to have.
Yeah, we gotta reframe that, and that's some CBT just in the creating of the intention itself. But instead of I don't want to be depressed, just say I want to find joy in my life, right?
Yeah.
So
as a complete amateur, that was a huge help because I wasn't even good at forming an intention, and between the app and the guides and the tutorials and all stuff, that was able to give me some to use and then start developing that skill of making good intentions.
Absolutely. And that's the guide's role. That's one thing that they'll talk to you about on your before you take the medicine the first time, is they'll talk about intentions and really help you formulate those if you're not sure. Mindbloom's go-to first intention for your first session is trust, let go, be open. And that's a good one for any time, whenever you want to bring that back. I'll bring that back occasionally.
Yeah, that's been huge. I think that's worth diving into as well. Like, what do those 3 things mean? Because I know one of those has definitely helped a whole lot in what Ryan and I are doing.
Which one?
The let go. They have kind of a special meaning in this, and it's kind of a skill to really get into what are trust, what do those 3 things actually mean? But why don't you explain those 3, and then we can go into more of how those have actually connected in the real world.
Sure. So trust, I think trust is trusting the process and then trusting yourself. Often a fear people will have is, what if I go crazy, or what if I go somewhere and I don't come back, or what if this doesn't help, or what if this does help?
I like it way I am.
Right. But it's comfortable, right? Even though it may be miserable, it's our body is always seeking that comfort. So
trauma makes me funny. I don't want to lose that.
You what?
It's real.
My trauma makes me funny. I don't want to lose that.
Right. Like I love being satirical, like BoJack Horseman, kind of wallowing in my own sorrow, type thing. And I was that way. I really was. It's something about like being that wounded soul that we, for some reason, I don't know what that is. I don't know what that is about that. Hopefully it's changing, because it's not ideal. So trust, let go. So
let me stop a little bit on the trusting a bit.
Sure.
So I come from a very scientific background, and that's made things very difficult for this, content creation, writing, and everything stuff. Like every time I'm going to write something, I want to make a documentary instead of a story. And every time I'm trying to learn something, I can't take the first step until I've known all the stuff that goes on the way. I remember one day being in one of my engineering classes in college, and it made sense for that kind of career. They'd say, if you don't know what you're going to do before you take the first step, you could actually kill people. You can't, you're irresponsible. For art, there's so many things you can't learn unless you're taking steps before you know what the end thing is. And that experience, not just the medicine, but the training you guys shared with me of the whole trust thing, got me to start taking the steps of, okay, I have a hunch that this is going to take me somewhere, that I should read this book, or I should, listen to this book on a walk, or I should try this style of editing. And I don't know, this could be wrong. but I'm just going to trust and give it a shot. And so many times it's paid off.
Mm-hmm. Absolutely. Absolutely. Because you're trusting the process and you're not having to know everything that's going to happen. Trust too is one thing that has been really helpful for me is the practice of non-attachment. A little kind of Buddhist, but non-attachment to any specific outcome, because that's where suffering happens, is when we have an attachment to a certain outcome, good or bad, and it doesn't happen that way. And then it's like, whoa, like, what happened? So yeah, that trust is just in so many ways. The trust yourself, trust the process, trust the unknown,
Trust the unknown.
yeah, because it is unknown. I mean, it is scary. I was nervous. I was very nervous before I took ketamine the first time, and I had been prescribing it for months before I actually even started it. I mean, like I was walking all these people through it, and I was like, oh my God, how am I going to hold the medicine this long in my mouth? I'm going to swallow it, and all that. But that trust, and that leads to the let go. Letting go is one of the hardest things for people to do, because we always want to try to control the experience or know exactly what's going to happen. And that, again, is trusting the unknown, right? And being able to let go. The more that you can let go, my best sessions have been when I'm just like, just do whatever. Just show me whatever. Just do whatever. I am here. I am not going to try to control it. I'm just going to be really open to whatever comes up. There's a lot of control freaks that will do this, and they'll tell me like, I'm really controlling. Yeah, I like to be in control of what's going on. It scares me. And so it may take a little time, to get used to it and be able to really truly let go. But the more you can, the more you're going to get out of the experience. 100%.
It's a skill that you build, and it's like I never would have had the quote unquote training wheels to be able to try that a little bit, and that allowed me to, and then start to build that muscle and get better and better at that. Yeah. And that's gotten to where even more of that stuff where maybe there's some direction that our project will go. I'm like, okay, I don't know where it's supposed to go, but I'll follow it. And during the sessions, there'd be a lot of times. The biggest thing for me was when I would have one I didn't feel like I got a lot out of it, and I'd be trying to push it to like, we need to explore something deep or have some insight, and got better at, well, just let go. Like, it'll just, take us where it needs to take us. And there was a lot of really insightful things that I could never have learned without that.
Absolutely. And a lot of times insights are going to come after the session, like weeks after the session. For me, I'll get some in session. It seems like there's two groups of people, some that get those like big in session insights, where things kind of click during the session. And then when it happens afterward, like for me, it'll happen when I'm doing integration. One of my favorite integration techniques is dancing, just in my house, listening to my favorite music with my AirPods on, and I'm just dancing freely, and I will get floods of insights that will come through.
No way.
Yes way. And so it really, like, making it your own individual process and what works for you. There's so many different integration activities that you can do. But yeah, you should. You definitely should. Dancing is very important and very helpful. But I guess to go to the be open, being open to healing, being open to the experience and not having to control it. Being open to any kind of outcome, and that goes back to expectations, and really it's hard not to have some positive expectations when you start ketamine treatments, but you have to keep them in check, because it's not always gonna be big improvements. A lot of times it'll be more subtle. For me, 6 sessions, really, it was the awareness. I got some more awareness and I got some relief, but I was nowhere near where I wanted to be or needed to be. So the process can look very different for each and every person. It's one thing I find fascinating about the ketamine treatments is it's not FDA regulated, so we can do more individualized treatments and not be so I got to do this and this and this. And that gives that freedom that I feel like we need in so many other, medicine and treatments and things like that.
To have a different level of dosing based on the need.
Yeah, dosing, frequency, because everybody's so different, and we just try to put people in boxes and treat everyone the same, and we're just all just so incredibly unique.
Can you walk us through like anything of this situation should be like more or this situation is less, and how that works out in benefits?
Mm. Well, I guess in regards to like if somebody comes back for more treatments.
Well, you said it's like a useful tool in your belt to be able to customize it. What sort of things do you customize it for, and how do you like decide, and what benefits do they get from that?
Sure. So dose would definitely be something that we can customize. Typically we'll start people out at like 300 or 400 milligrams, just depending on their weight. And I'll have some people that will stay at that dose. More times than not, we'll increase it a little bit. And then there's some people that are like, I don't feel nothing, increase
Mhm.
it, and it was okay, but still pretty mild. And so we kind of like double up, on it and get to a point, because sometimes it's going to take a lot more medicine to really let go of that anxious mind. If you're really wound tight and in that fight or flight mode, it's going to take a bigger hammer to get this nail in. Sometimes it's all about the size of the hammer. How big of a hammer do we need for this person right now? And that could definitely evolve as you continue to grow and heal. So that's one way. Another way is the frequency. So most people are going to be similar in their first initial treatments. After that, it can depend. I'll have some people where very treatment resistant, seeing some improvements, but still got a long way to go. Well, let's do another round of 6 and let's continue to do once a week. And then, another person will have a lot of improvements, feeling a lot better, wants to keep this around and do a maintenance, treatment as they continue to do more work, but they are much less anxious, much less depressed, in a really good spot, made some positive behavioral changes. So, okay, then we don't need to do it once a week. Why don't we start to space them out like every 2 or 3 weeks? So one way people will do it is just continue to increase the intervals between the sessions. And then another way is people will take a break and monitor mood, kind of see if and when the symptoms start to creep back up and stick around. And it's like, okay, well, I noticed my anxiety coming up at about that 4-week mark, and it was really hard to calm myself down. So maybe once a month is a good, you know, uh, pattern for me to do. So really, yeah, those are the main like customizable things. And then of course your integration plan can be different. You could recommend meditation and breath work to one person, and you could recommend yoga and walking for another person. It's just, there's a lot of different things that you can really customize for people.
So I want to talk a little bit about the during this session. So I know that at least, the Mindbloom is what I'm familiar with. There is some spoken word stuff that they have you watch and learn from before the session. Then there is some music you listen to during the session with some spoken word at the beginning. And then there's some prompts afterwards. Can you walk us through a detail like what the Mindbloom thing does and what you do different with your personal clients and your thoughts behind that?
Sure. So yeah, you're exactly right. Mindbloom will have kind of an introduction to whatever topic you're on. It'll have a prep tab, so you'll go and it typically will have a video to watch and some content under it with bulleted points. Gathering the main points from whatever they're talking about in the video. We'll get to you to start thinking about what your intention is. There's a place where you can also put your intention. And they are really utilizing that AI. So AI, will be like, do you want to generate a response, or regenerate it with AI? And it will turn into some beautiful intention sentences. And then you then are ready for your session. You go to the tab, has music with each session that you can customize to, because some people don't like certain types of music, can really kind of bother them. So you have the ability to change a track to one that is more suitable for you. And then,
are they like all binaural beats, or are they like pop music? What's the range that you can pick from?
Typically binaural beats, but some are more like ethereal. Some are more like nature sounds, like birds, like water, things like that.
Is
More
there a purpose to the
drony.
binaural beats?
there is a purpose. There is a purpose. Yeah, a little beyond my scope of how exactly it works. I want to get more and learn a little bit more about sound healing and music therapy. But it's absolutely it's a huge piece of this. I mean, there's really like 4 big pieces. You have the medicine, you have the integration, whatever that may be. You have the music, and then you have to me, connection to nature. I think one of the best things that you can do after a session is go outside, your feet on the ground, or go for a walk. I had one client who said, I went out in my backyard and saw this tree that I have never seen before in my life. I didn't even know this tree existed. Just like that attention and the awareness and the presence that's there, and nature just brings, just really just brings more of that up. So,
you're seeing everything with fresh eyes for
yes.
like the next couple of days after your session.
Yes.
And that could be great for your creative process. It's so great for examining your emotional stuff too. But all of it is just, wow, I'm seeing everything instead of the stuff I got used to and stopped paying attention to.
Absolutely.
Before we get too much into seeing the world from a new perspective after, do you mind if we go back to during, and can you just walk me through what the actual taking it looks like? I know you mentioned wearing like a blindfold or something, of course, music, and then you mentioned, at least for the first session, having someone there kind of as a chaperone.
Absolutely. So supplies that you need. So Mindbloom will supply a journal, an eye mask, and a blood pressure cuff that goes on the wrist. So that it's important to check blood pressure and heart rate before and after, because it can have a stimulant effect to the heart. And you want to make sure it's in a low enough space. So, and then you also need headphones to listen to the music. Noise canceling is best. Of course, since you're doing it at home, there can be a lot of distractions. So set and setting are so important. I'll share with you a little later about my last experience with ketamine, and I had to learn yet another lesson about setting. But your mindset and the environment in which you're doing the session can really make or break what happens during the session, which is interesting. But yeah, so really we're wanting to direct this focus inward. So the eye mask, I think, is really important as well. Now, whenever you have a session, my go-to advice is take that hour beforehand and prep. Get your stuff ready, take your time, get into it. For me, I take a bath, I listen to meditation music, change my sheets, I get everything ready and together, and just kind of slowly get myself into that mindset of the session. And then whenever you're about to take it, you want to make sure you have all the things that you need. The tablets that they use are rapidly dissolving tablets. So they're kind of thick and big, and you have a number just depending on how much you're taking, usually no more than 6 tablets. But essentially you put them between your cheeks and gums, and you let them sit there and dissolve over several
Little
minutes.
squirrel face.
Yes, yeah, like one of those dogs. So you let them dissolve. It mixes with your saliva. You're holding all that saliva and medicine for about 7 minutes, 7 to 10 minutes, just kind of depending. You don't swallow anything. That's one thing that I love about Mindbloom's protocol, and I'm pretty certain that they came up with this. Most people that are doing the oral are doing a lot lower doses and swallowing it. And so what happens when you swallow the ketamine, it goes through the liver metabolism, goes through your GI tract, and it turns more into a metabolite of ketamine called norketamine, which can produce more of those anesthesia type effects. Makes the session last a lot longer. The recovery time is longer. And it's also a lot harder to remember what you actually experienced during the session because you're just more dissociated. And when you swallow it, it extends the session typically 2 hours, because you have that initial kind of hit with the sublingual absorption, and then you have a second one whenever it's going through your GI tract. I've actually tried this before because I wanted to see what it was like, and it was intense, and then I was out for the rest of the day, just really tired. And so that's, about Mindbloom's protocol. I love it. I really think that they've got it spot on, for it to last an hour, to be back to your normal with 3 hours. So after you hold it for that 7 minutes, you spit everything out into the cup. So, one of the things we teach people, which is really important, because when we're prescribing high doses, and if you swallow 1,200 milligrams, I've had somebody do that. And it was
Why would you do that?
The pharmacist told them to swallow it. It was a whole thing. This was in my private. Oh my God. And it was like an ayahuasca experience. I mean, she got really sick, but she got a lot better too afterward, which is interesting. But, she was scared to do a treatment for months after that happened. So back to the session. So you spit it out, and typically you'll start to feel it kick in by the time you spit it out, or a couple minutes after that. So after you spit the medicine out, you kind of sink down, you put your eye mask on, you got the music going, and then you just go. It really is kind of like a peak. So it peaks halfway through, and then coming around to the hour, you kind of shift back to the present moment. And then after that hour, like how Mindbloom does it, they have chimes. So whenever it's been an hour, you'll hear a little chime. And then you'll also have your peer treatment monitor, which is what they call it. And you have to have that person with every treatment. You don't have to meet with a guide for every treatment, just that first one, but you do need to have somebody there to hold space for the sessions for sure.
Yeah. And they're not doing anything. They just need to be physically there. So
They're
in
there.
case.
And
So
they don't
the
need to
whole
be
time
in the
you're doing
room.
it, you're doing a real thing by yourself.
You're doing it by yourself. Yeah. I don't typically recommend people being in the room with them unless they really want it, just because that can affect the experience. But yeah, they just need to be there.
It's like a lifeguard.
Yeah.
So if this is you had a question there, Ryan?
No, I was just saying that sounds great and really interesting that you spit it out afterwards. Even it's just that potent, I guess.
Yeah, because what we're trying to get to is that peak plasma concentration of the sublingual absorption. And so that's, one of the studies they did whenever they started Mindbloom is how can we change this up a little bit to be more effective, to not be so, heavy on the side effects. And I think they've just come up with a bomb protocol, really. And I have just having people that are doing the hold and swallow method with the lower doses, they're not getting the same results as the hold and spit, which is very interesting. And I think it has to do with the side effects that people experience, and then the more dissociative, like you're not really able to recall the experience as well, which I think is a big piece of the healing. You have the neuroplasticity of the ketamine, which is working regardless of what your experience is. But I think a big piece of this is that experiential, whatever happens during the session. I mean, it can be very meaningful. And if you can't remember it, well, then how am I going to integrate this? How am I going to properly integrate it?
I definitely feel that shorter is a feature and a benefit because I'll be into it like 15, 20 minutes and I have a lot of really good insights. And I'm thinking, oh, crap, I'm going to forget these. And these are so important. And if it was something where you could say, hey, we have like a 6-hour thing, you might say, oh, 6 hours is better than 1 hour. For me, 1 hour has been perfect because then it ends. I remember so much of what's happened. I can take my notes and actually start integrating and applying those insights.
Absolutely. One thing that I'll do, because I have a business cell and a personal, so I'll record, I'll do a voice memo and I'll record myself. If I'm in a talkative mood, then I'll just kind of talk out loud, like what I'm seeing and what I'm experiencing.
I'm going to try that next time. That's a great idea.
Yeah, it's really cool. And it's really funny to listen back to. But yeah, so just kind of to complete it. So after the session, on the Mindbloom app, they have an integrate tab where kind of focuses more on integrating the experience. And with my private practice, I don't have the fancy app. I don't have any of that. I have music playlists that I'll send people, and I really leave it to the integration coach or the therapist. Like I work closely with these people because I want them, to be the ones that are working with them, more often, every week, things like that. So they'll be more in charge of that integration piece. And then of course I always have my 2 cents that I'll throw in there. But yeah, I'm finding that it's hard to get people like, Ethan, how you follow up after your second session and then you get more medicine. Well, my private practice, even though I've told them this and they haven't, it's hard to get them to follow up. So typically I'm seeing them after they've done 4 sessions, so the app is very helpful and something I really want to look into for my private practice.
So speaking of that, there's something that I prepared that I wanted to show Ryan before we get to the next segment.
Okay.
So if the share screen works, this will tell you what the setting of this is. My last session, I'm going through the one on building better habits, and it was number 6 to end of it. And the AI helped me come up with like a pretty good intention and refine it. And I had like this rambling thing about how writing is so stressful, and because of the uncertainty and all this other stuff, and I need to know clear answers to the next step and everything. But we talked about that. It doesn't work that way. You need to be learning from the uncertainty, and I get with a nice clear one. Show me how becoming comfortable with the uncertainty of learning to write is the path to like unlocking that potential. I was like, great. So we get started, and then there's a 60-second video that listen before you get started that gets me thinking about it. And when I was watching this video, it really reminded me of someone that I know very well. And I figured I wanted you to see this.
Interrupt it with this 5, 4, 3, 2, 1, and then go, what if it all works out? What if this turns out to be one of the hardest things I do, but the best decision I've ever made? What if placing a bet on myself was the moment my life changed? Because you can't argue with that. And it literally stops that sort of cycling, because worrying is just a habit that you have. It's like a pathway that you've plowed in your mind. And it's a protection mechanism. And by staying in your mind, you think you're safe. And really what you're doing is you're holding yourself back from living the life that you're meant to live. What if it all works out?
Ryan, it's you.
You say that?
I don't think I would say it as eloquently, but I like to think I'd say something similar.
It would be phrased, I love it when a plan comes together.
That is something I would say.
But you talk about all the time of, I take all these big risks and they seem to work out, so I just keep taking them. So,
Life finds a way.
So that was cracking me up. Like, that really reminded me of like your spirit and like the really where it's like, you're right. You should worry about this stuff, but like, what if it all works out? Like, oh yeah.
What a great person to work with and be friends with, to have that positive mindset, right?
Mm-hmm.
Yeah.
Until I'm overdoing it on the, it'll work itself out.
It always does.
Ryan's definitely a good influence of taking, not like life-threatening risks, but, hey, this might be scary, this might be different. Just go for it and see what happens. And so many times it's actually brought more and more good things that, like, just double down on it.
Mm-hmm. Absolutely.
So then after that, the thing starts playing for the hour, and it gives you like 7 minutes of somebody talking about an interesting topic related to that while the medicine's starting to like get engaged.
Right.
So instead of just sitting there sharing like you have your own intention, and you're probably gonna have other ideas that will come into your head, but it gives you like a good foundation of like getting your brain brainstorming.
Mm-hmm. Absolutely. And they also, because I have a lot of my ADHD clients who will get bored if it's just all music. So Mindbloom also has guided meditations that are fully guided. So they'll come in every like 10 to 15 minutes after that initial talking, and they'll just kind of bring you back. Okay, this is what we're doing, kind of reinforcing that. And people have found that very helpful.
I never thought about that. That's brilliant.
Yeah. You need to try one.
There's one that was really interesting, and I keep coming back to the medicine's great, but the skill around this and the skill of the team that supports you is such a magnifier to a complete different degree. There was one where it was, we're going to do one where you're going to meditate during the session. And that's not something that I've ever done. It's, I want to think about this topic. I want to think about that topic. And it was specifically just for once, we're going to think nothing and just try to meditate. And the medicine kind of like mellows you out a little bit. It lets your mind, not be super distracted. So it's easier to meditate. Mm-hmm. And I got to this super deep level of meditation that ended up being one of the most intense session I had from thinking about nothing.
Mm-hmm. How was it intense?
I don't know how to put into words. It was like we're sitting there and it starts wanting to probe or go someplace. And I'm like, okay, I'm just chill. Thought comes in, thought goes out. We're not going to, chase you. And then it felt like it just started going to, okay, you don't like questions. What is a question? I'm like, oh, okay, that is a question. It's like, okay, what is? And it just started going deeper like that. It was like, oh, we're just getting to like, imagining we're an atom right now, aren't we? And, and the one thing I keep coming back to is there's something to learn along each step of the way, like being super intense session, mild session, or little, being completely rested, being super active. We try to get like these little chunks, like, am I a jock or a nerd? But it turns out that each little mix in the way has its own unique lesson to learn. And from this, it was getting back into like super abstract stuff where I couldn't put it into words. But when I spent that week kind of just reflecting, so many important things in life click together. It's like there's things you can learn from science and there's things you can learn from art. And if you only do one, you're going to cut yourself off from half of it.
Right.
Well, there's certain things you can learn from words. And it turns out there's things you can learn from whatever the hell that was, not words. And that was the only way to learn it.
Absolutely. Absolutely. That's very interesting. I'm glad that you feel that way. I run into this a lot is when people will have big insights and big sessions and, things really happening during the session. And then they'll have one that's, they're basically describing a meditation, just like the one that you had. But they're like, well, no, I didn't get any insights, or it just felt too mild. Like nothing went on, like kind of upset about it. And I'm like,
yep,
that's what you needed, so there is a lot of like coaching and counseling involved, because everybody's always looking for that big epiphany, to happen, and think that, like, can you imagine having epiphanies just like continually, like all the time? Like that's overwhelming, right? Like give yourself a break, man. Like, and
welcome to being Ethan.
right.
This is why I never shut up.
Well, I'm glad you brought up the meditation piece, because I really see this as ketamine assisted meditation. Meditation is something that I recommend for most people. I mean, I don't know who I would not recommend it to, maybe not in certain situations. But meditation is something that you can take with you after you're done with the ketamine. Really practiced meditators will have a ketamine experience without ketamine. They have the visuals, they have the physicals, they have all of the things, but they have no substance involved. And we can all get there, but it takes practice and it takes time to get there, and so that's why I really push that, because that is something that you can start to practice with the ketamine treatments. 1 day a week, just do a meditation, start low, start at 10 minutes, 5 minutes, and just continue to build from there. And once you've experienced ketamine, you can really try to tap into that space and remember what you felt during the session. It can really help sink into a meditation.
It's
so
really
just to clarify real quick, are you telling me that Ethan needs to practice letting go?
Yes.
Always.
Me too.
I'm a work in progress, Ryan.
Yeah, I am too. We all are.
Of course.
I absolutely have to give a shout out to my guy Brian, though. The whole thing of being like learning and appreciating those mild experiences, that's not from me. That was from him. This is, again, like the whole process behind it, why it's so much better to have a team instead of just having the chemical and just doing it yourself. I remember after my first session, it was really mild. I talked to you like, hey, I think I need a higher dose. And then I talked to him because it was scheduled for that. And I was like, what's up? Every single time, like, you've had these really quiet questions that sound like nothing, but I think about it for 15 seconds and I go, holy crap, you just broke my vein. This is the best question ever. And I said, this is not much happened. He's like, yeah, okay. What about this? And what about that? And, 20 minutes into like the discussion, I was like, oh my Lord, I'm learning all the things I could only be learned from a mild session. And that I could have to go back to my notes to say exactly what he told me, but going through that the next week with the questions he gave me, which I wouldn't have the wisdom to ask myself, that was one of the most insightful weeks I had.
100%. That's why it's so important to have a good guide or a therapist to walk you through this. It makes or breaks it, and you're going to get so much further if you're working with somebody that asks those questions and that is familiar and that knows what they're doing. And that's why I am not a fan at all of people that don't do integration with this. I don't think it's okay. I think it's dangerous, really, to be honest with you.
Dangerous.
Yeah, I mean, it can be. It really can be. Probably for certain types of people. Like I've had some experiences with people with personality disorders that can really send people in a spiral. And if they don't have the appropriate support, that can be not have a good outcome. And I do think, people can tend to get lost or give up, especially if it gets too hard and they just don't have that support or that person to ask questions with. So in my private practice, I require people, you either have to see, my local therapist, you got to see these integration coaches, or you have to have another therapist, and I get their contact information and we coordinate, and coordinate your care, because it's not in my integrity to prescribe the medication.
I would personally just feel like I'd missed out on so much of the benefits if I hadn't had all this stuff.
Yeah.
This may be an odd question, so, no need to answer, but it's not. But it makes me wonder what fraction of the money from the payment goes into all these other things. So I know, the medicine itself has to be paid for. There has to be all kinds of development and the legal things around that. Like, it doesn't just get to make the powder, but like how much of that slice is going to the the guides and the people who train you and stuff, because that's been such a massive part of this for me.
Really, really is. That's a good question. I'm not really sure. Actually, thinking about it, because Mindbloom does a buy and bill program, so they'll work with private providers and then they'll offer everything else but the Mindbloom clinician. So you get the guide, the app, etc. And I'm pretty sure that cost is like maybe $500 or $600. Yeah, out of like the $1,200 for a full initial session. Yeah, so about half, is what it looks like, but I don't know the numbers in particular.
Okay, I'm glad it's like in like the meaty part, because that's been such a huge thing.
Yeah.
Like how I heard about this was from that podcast who are really into like psychedelic therapy. They're trying to actually start a clinic of their own, like whenever they can. And they kept talking about like, this is a great idea, but the support is so weak that we can't recommend it. And it's gotten so much better since then. And that's been the whole thing, that I want to see that part keep growing. Like the medicine, it's not going to change. That part solved. But having the guides and the support people and like the messaging you put into it, if that can continue to grow and get better, I think that's going to like make this more effective for everybody.
100%. Well, I'll tell you, when I started with Mindbloom, we had no support. There was no support team at all. So essentially, the guide was doing everything, like contacting the patient. I don't think they had any kind of support like put in place at all. Maybe like one person, but it wasn't like it is now. I really respect and admire Mindbloom. They're a pretty big corporation, but they continue to improve, and they're invested in continuing to improve their product. And I just the evolving of the music and the app, and now we have a whole support team that's now 24 hours a day. I can't really say anything. I can't say anything bad about them, because I'm not a big fan of big corporations. I couldn't have picked a better one to be a part of, and they continue to make things better for the clients and then also for us, so I appreciate and respect that.
Oh, so I'm happy to be working with them.
Yeah, you picked a good one.
I'm good at picking people.
Yeah, you picked me, of course.
Obviously.
Very glad he did.
So
can I ask you like a dummy question?
Okay.
You were talking about the support crew. I don't actually understand so much of that. Could you tell me a little bit about like, the clinician and the guide and anyone else involved and how they interact and how it all works?
Okay. So the support crew, they have a support at Mindbloom. So that's an email that I'll give out a lot for just any like logistic stuff. They also have a chat option. So essentially the chat, which I forget, they just started using a new one, but the guides will use that, and then the support team will use that. So, if anybody has any issues and need to reach out, likely the first person that they're going to contact is support, and then support will then connect them with their guide or, whoever, or the clinician. So I, am on Teams, on email, talking to guides, talking to support people if they have questions about clients. They do keep us separate, so clients can't directly contact us unless we give them our contact information. So it's a lot of coordination between the three groups of and working with clients, and I think it works out really well. It used to be messy, but really it's grown a lot over the past 2 years, and it's gotten very efficient. And they just continue to change their protocol as well. We used to send the medicine out really different, one session at a time, and then we'd see a session, one follow-up with a clinician, and we'd send the rest of the 5. And the lag time between treatments was that gap was pretty big. And it's really important just with that momentum that gets built in the initial treatments that you do them closer together.
Yeah.
So, and Mindbloom does a lot. Like, one thing I'm involved in right now is we're looking at different routes of administration of ketamine. So they are in phase 2. We're about to start phase 2 of a subcutaneous ketamine trial. So essentially it's like giving yourself an insulin shot. So you're able to self-inject if people are comfortable with that. And it provides a more deeper experience, has more bioavailability than the oral treatments do. And a lot of times people will have like poor oral absorption. They're not able to get, the experience that they're looking for. And to be able to offer these various products, I think is going to be really cool to see. I participated in the trial of the subcutaneous, and
Oh, wow.
I'm a big fan. Yeah. That's what I've been using recently. It's very consistent, a lot more consistent than the oral, in my opinion. But yeah, it's just really, really, really cool to see all the. I mean, there's rectal suppositories, there's nasal spray. I don't know who would do rectal, but there's nasal spray, there's the sublingual, the intramuscular, subcutaneous, just a lot of different ways to do it. And I think they're providing a lot of great options for people to meet them where they are.
What's the difference in responsibilities between the clinician and the guide?
So the clinician is like the medical provider. We deal with the medication, the dosing, sending in the prescriptions, doing the initial evaluation and the follow-ups. So really in charge of that. And then the guide is more in charge of the integration. So the integration sessions that you have, the first session that you do with the guide, and then they're that main point of contact for clients where they can reach out to whenever.
So I feel like we got a general idea of the Mindbloom. Before I shove more into like talking about your experiences and your skill set, Ryan, do you have any more questions on this topic before we leave you behind?
I mean, the only one I have is, how are you able to ship ketamine? Like, can you cross state lines? How do you do that? Because I can't even ship whiskey to Ethan right now.
Freaking communists.
It's a thing. And so luckily Mindbloom's, reach, they're able to connect with these pharmacies and share their dosing guidelines with them. One thing I've run into this issue in my private practice is telling the pharmacies about the hold and spit, and they're like, how are you trusting these people to spit this out? But Mindbloom has the resources to really work with them and come up with a plan. And so we have, I think it's like 4 or 5 different pharmacies for all of Mindbloom. That some, we'll have primary pharmacies for certain states. There's some that ship to all 50 states, but they have it kind of set up to where, okay, this is primary for Tennessee, this is primary for Florida, et cetera, et cetera. So the pharmacy has to be licensed in the state where the client is, and the client also has to be in the state where they say they are. So, and then of course, I've had a lot of people that'll be like, well, I'm in North Carolina. Can you ship it here? No, I can't. I have to ship it in Tennessee. That's going to flag the DEA and I'm going to get in trouble, So, yeah, it just depends on the pharmacy, but they have it set up that way. And I'm still working on figuring out pharmacies for my private practice. It's super fun.
So
Yeah,
just to clarify, is your private one only available in Tennessee right now, or are you in more states?
Yeah, so I'm in Tennessee, Florida, and Wyoming.
Okay.
Mm-hmm.
And then is Mindbloom in all 50, you said?
I'm pretty sure they're in almost all 50. I know Alabama is not in Alabama, and I don't believe it's in Mississippi. Yeah, so I'm thinking like maybe like 47, 48 states. There's another one I can't think of, but it's in most states except for those ones.
Yeah, once they brought it to Tennessee, it's been pretty much everywhere else.
Well, when I started, I was the first clinician in Tennessee. So they had just opened this up in Tennessee 2 years ago whenever I started. Yeah.
Yeah, that's how I kind of got wrapped into this, because it was just barely being legalized in Tennessee. So I started hearing about it. And I was like, oh, well, I will save up some money and have that for my birthday present because this is, it's fun to be first.
What a wonderful birthday present to yourself.
Oh my Lord, I had no idea how good it was. Yeah, like Ryan, like flat out, like if I hadn't done that, who knows if I would have, started working on podcasting with you, done all these other things, and met all the great people we've met through this stuff. Like I'll probably do a video later talking about all the specific things that it helped me in content creation from this experience. But the number one thing was just making my life more intentional. Instead of like, hey, what's going on today? Let's just enjoy that. It's like, no, there's things I really like. There's things I really care about. And let's actually focus on making those happen.
Absolutely. Yeah. That's what I found in my life too. Like once I started these treatments, people, places, everything just started coming into my life, and everything just built on each other. And it's just been an incredible journey, man. It really has.
Can you tell us any examples? Anything that come to mind?
Well, there's been a lot. I met my best friend, like shortly after I had my first few sessions, who has become my best friend and my business partner. She's a therapist here in Memphis, and she's an incredible woman. I'm 33, she's 57, 56 or 57, but very, very young at heart, very wise. She's really got like half of the world figured out. Like I'm so grateful to have her in my life, and to have a best friend as a therapist is not a bad best friend to have.
That might make me a little
I got my
worried.
best friend who's a therapist, so I'm just like I've got it all going on there. So her, and then the other couple that I work with, where I do the ketamine breathwork retreats, they also came into my life. And last summer is when I met them, and just aligned. And it's just like, I'm able to now understand, be present enough and intentional enough, and trust myself enough and my discernment of people and their intentions. And if this feels good or if it doesn't, and I didn't know that before. I just had that lack of understanding, and kept having all these toxic people in my life. And I'm like, what is going on? Why is this happening? And so I really attribute that to the healing I did with ketamine and bringing all these wonderful people, and really get my private practice going. And yeah, those are the ones that come to mind. I don't know, there's been a lot more.
Speaking of your experiences, can you tell me, I know you said you prescribed some before you tried it. Can you tell me what it was like after you tried it yourself? How did that change moving forward?
Oh my God. So I started with Mindbloom in May of 2022. And like I said, I found them because I wanted the treatments myself. Well, because I was the first Tennessee clinician, I can't prescribe it to myself. So you're right. I wish I could have. I'm trapped. I'm like, well, hell, like I can get these treatments for like very cheap, and I can't even get them unless I go to another state. So, I had been planning to like go to Florida and like get it sent to my aunt's house, and it just like never worked out. So I didn't start the treatments until December of that year. So during that time, I was working for Mindbloom. I was doing another outpatient at home or Suboxone treatment because I worked in addiction. And then I started my private practice doing like the life coaching and things. So I was doing I was work addicted. I was just like, okay, let me just pour all of myself and attention into working nonstop. And so like the burnout was just huge. Right after I started my treatments, I had a friend that was not a good relationship. It was very toxic. I needed to cut ties, and it really triggered my PTSD, what went on during that. So once I started the treatments, after I got regulated myself, which was funny, and when my first round, the second and third week, one week I was more depressed than I had ever been, really. Like laying in bed, seeing my Mindbloom clients with my video off, just not able to get out of bed, like much not functional like I was before. And then the other week I was like a lot more anxious, just very on edge. It was like it was intensifying these feelings that I had been experiencing and really bringing them to the surface. And then once I got over that hump, I remember talking to my integration coach, and she saved me with this. She saved me with me understanding what was happening and why it was happening and how to move through it and do some integration, because I was having a really hard time integrating. When I started out, I knew all of the things I needed to be doing for myself, but I couldn't get
In the
myself,
head.
I couldn't get myself to do it. I was not walking the walk, and I was just pouring my energy into other things to not face myself. So once I started the treatments and just started to see like what this actually was going to do for me, my experience with clients completely changed. How I worked with clients, I feel really bad, honestly, like thinking about some clients that I saw during that time, just how dissociated I was, just like not present at all. And so I think that was a piece of it. And then two, just understanding the medicine more. I have my own experiences to bounce off of, and it just, my work with clients just it dramatically improved. And I could just tell by their responses and how I felt seeing people. Before I started the treatments, I got to the point where I was annoyed before getting on every single call. I was just like,
Oh,
I was
wow.
doing too much. I was doing way too much. It was way too, and I was like, oh, and I'm like, I remember during my ketamine session, I was like, why am I doing something that I get annoyed at? What the hell is that about? And it's just because I wasn't taking care of myself, and I'm listening to everybody else's traumas and not facing my own. So that's gonna create some issue. But yeah.
We get into that a lot ourselves. Like the burnout, that seems to be such a universal thing where it's kind of like my motto of like, we can learn to do all these new, hard and difficult things, but how could we learn them while enjoying learning it?
Right.
And it's completely possible to hate it and be burnt out the whole way, or to be doing something and be happy that you did it.
Right. Exactly.
Could you like tell us a little bit about your burnout advice?
Mm. Wow. That is something that I'm hard practicing right now. I'm really focusing on. Burnout advice is stop, relax, don't do anything. Just stop. Just let go. Like, it has been really hard for me to get out of the action mindset and the doing mindset and just, doing things because it feels productive, but it's not actually really helpful. So I think what I'm going through right now is just a period of, okay, well, I may not get a lot accomplished during this time period, and that's okay, because I'm retraining my body to not be in fight or flight or urgency mode or people pleasing or trying to make something happen. One thing I have come to understand, and the biggest things I've gotten out of the ketamine treatments, is that more understanding of the universe. It doesn't work that way. You don't manifest things by making it happen, where that's just so poorly misunderstood. How you make stuff happen is by trusting and letting go and putting out there what you want and not being attached to the outcome and being present and taking care of yourself, and having inspired action. I think that would be a big piece of advice is don't take action unless it's inspired action. That was my goal or challenge last week, only take inspired action. And I wasn't having a lot of inspired action because I needed to rest more. I needed to relax more, and the inspired action will come. It will come, like get what you needed to get done. But the busy work and the doing action thing is not serving anybody.
There's a lot to be learned from inaction as well as action.
A lot. And I'm like, I don't know this life. This is weird. I'm used to doing stuff and it's a practice, but when I do it really like all day, my day is incredibly amazing. Things will just happen. Things will just come to me. Things will just come to me. And I can pull a million all-nighters and these things will never happen. Yeah.
I want to leave a little time to like get to know you a little bit more too. People who are this like intentionate and passionate about what they're doing, there've definitely been like a track that took them there that was unavoidable. What about you do you think made you this kind of person? Like, growing up, or your influences as a child, how is like you the person that had to have become this Lea?
Well, when I was in high school, we had moved from a small town that my mom had lived her entire life. We moved across the state from Dyersburg, Tennessee, if you guys know where that is, to Chattanooga. And it was really hard on my parents. They couldn't sell their house, and it was really hard on my mom.
Oh, wow.
She, moved for my dad's job, so she didn't have a job. She kind of like felt like she lost her sense of purpose. Well, she was diagnosed with bipolar disorder when I was a freshman in high school.
Hmm.
So, and it was pretty severe. She was in and out of inpatient hospitals, multiple suicide attempts during my high school years. So many different medications, just either didn't work, or she was passing out on the couch, at 6:30 p.m. because she was so drugged up. And that was painful to watch, and it really took me some reflection and understanding, like, oh my God, like how they treated her, and how, the medicines that they were not helping her at all.
Hmm.
And it was just atrocious to look at psychiatric care, from that perspective. So, she ended up getting breast cancer when I was a senior in high school, and went into remission, but then it came back, and she ended up passing away from breast cancer. And it was really,
Sorry.
thank you. It was really interesting because once she started dying, it was like a year and a half that she lived. But once we knew the cancer had spread, it's like her mental illness was like so much better, because she had like
Oh.
this, right? Like, it was like she had this something else to focus on.
Mm-hmm.
And yeah, that's just an interesting little tidbit. So, she passed away in 2011. And I became very passionate and interested in mental health and psychology after that, just like trying to understand her and understand what they were doing. Of course, that was a lot of trauma for me.
Yeah.
And then my brother, he died by suicide in 2017.
Oh, geez.
Yeah, and I thought about him watching your guys' episodes. I know you guys say you drink whiskey. He's a big Scotch and whiskey guy, but just an amazing person. Typical male who is funny, and it seems like happy-go-lucky to everybody, but really struggles inside and never really like got the help or sought the help that he needed. He was an alcoholic. He was a bartender. He was a whiskey connoisseur for sure. Like, he would go to the whiskey shows and things like that, but I think just suffered a lot internally. And so he passed away after taking a whole bottle of Tylenol after his 30th birthday. Which we were very close. That was my best friend. He understood me, and I feel like nobody else did. And so, those experiences with my mom and my brother, and then after, not to mention, after my mother passed away, I was in college. I was president of my sorority. Really had never struggled before up until that point. And I remember going to my primary care doctor a few months after she died, and told him my symptoms. Okay, you're depressed. You got some depression and anxiety. Of course, you lost your mom. Well, and maybe they mentioned counseling or therapy, like, oh, you should consider that. But they prescribed me Prozac and Xanax, instead of maybe going to get some grief counseling. And funny enough, this provider was a PA that was a PA that really made me want to be a PA. And I didn't put this connection together until recently with the ketamine treatments. And I think that was a really bad move, introducing those medications. I spiraled down pretty quickly. And so that next year, I went from like straight A's and some B's and being super involved in everything to, skipping classes and just getting really depressed, getting worse with my mental health. I ended up failing some classes. I had to take some time off of school because I was struggling so severely. I ended up going to treatment in 2013 in California for 30 days. And that was really like the start of my transformation. Of course, it was a long road, and I still had a long ways to go. But my own experiences with mental health and how it was treated and how I was treated, how my mother was treated with these medicines that seemed to make us worse. I would almost
Yeah.
guarantee that my mother was triggered into bipolar because she was started on an antidepressant. I would almost guarantee it. I don't know that for sure. Can't get her records, but so looking at that and really having that passion and that drive, like there's got to be a better way. There has to be a better way to treat these things. So I started looking into and researching functional MRIs. So I don't know if you guys have heard of those, but it's basically you're looking at the function of the brain, not the structure. And so started following Dr. Daniel Amen. So he does it's essentially the same thing, SPECT scans. So it shows like the blood flow of to your brain and certain parts of your brain. And so I was like, oh my God. So we can look at the brain and see what we're treating, but why aren't we doing this? Like, why is this not a standard of practice? Why aren't we scanning people's heads whenever they have a mental disorder? Because for all we know, it could be caused by some kind of function or structural issue. It could be a tumor. You could have had a stroke before and never known it. And then you're just going to throw Prozac at people and not really know why. It didn't make any sense to me. So I got really passionate and interested in that research. And when I went to PA school, I knew I was going to go into psychiatry. I'm going to work in mental health. Maybe I'll do primary care, but no, I always was going to work in mental health because I'm just so passionate about it. And I find that the more work that I do and what I struggle with, that's the people that I work with the best, right? Is like I'm learning how to help
People
myself.
sharing the same problems you have.
Yes. And then I'm teaching other people, what worked for me and how they can help themselves as well. So then when psychedelics came across, my awareness and looking into the research of it, I was like, oh, here we go. Okay, this is what my brother needed. Like, I can't even imagine like if Mindbloom was available or something like that. He would have done that. He would not have gone to get on an antidepressant, but he would have done a psychedelic, right? Like he would have been interested in that, and it could have really helped him, and it could have also really helped my mom. So I'm just a big believer in it. I think that the way that we have been treating mental health is not okay, and it's just made it worse, and we're really into this crisis right now. I just saw a statistic. Tennessee is the number one most depressed state. I think it's like 29.5%. Yeah, like we're number one in the number of people who are depressed. So it's huge, and I want to be a part of the movement and the shift and actually helping people and get to the root of the problem.
Yeah, that's a meaningful goal, and I can see how much joy it gives you.
Yeah, it does.
Well, thanks for sharing all that, the hard and the good.
Yeah. Thank you.
Why don't you tell us about your current practice? There's a lot of stuff going on with what you've learned and what you're building in the future.
Yeah. And I've recently in the past few months been trying to understand, okay, what kind of clients do I really want to see? So for a while I was had my own ketamine program with my therapist and then with the breathwork practitioners, and then I have my med management patients. One thing I realized is that it's not within my integrity really. Like I felt some type of way when I was just prescribing medications to people, the same medications that didn't help me, even though these people are doing okay, there was something about it that just didn't feel right. And I had to really work through that process of like, well, I work in psychiatry. Like if I'm going to do med management, I'm going to have to prescribe these medications. But like, do I really have to? Is this what I really want to do? So right now I'm focusing on ketamine. I have a handful of people that I've been seeing that I do med management with, but anybody I do that with, I do coaching as well. So I'm also a life coach. So I'll always incorporate that into my sessions.
So you do the integration with them as well?
Yeah, absolutely. Absolutely. Otherwise, like, what am I doing? I mean, like I said, just being a drug dealer, like I'm not interested in that. I'm interested in actually working with and helping people. So just to kind of simplify it, and as things grow and evolve, and hopefully eventually getting a physical location and not being all virtual, I'd like to grow the services. But so providing ketamine therapy, assisted psychotherapy, or in the retreat settings, which are really super cool to experience a group ketamine session. And then what I'm thinking I'm going to do is look into some more training, maybe like some kind of therapeutic training, looking at like neurofeedback or biofeedback, or some somatic experience work. And then I'm also too, one of my passions is spirituality. And I have a little bit of shame around this, but we'll let go of the shame. I love astrology. One of my hobbies is astrology. I find that fascinating as hell. I really do. And like looking at birth charts, and like I'm okay, look, I'm kind of witchy. I'm kind of woo-woo. And it's been really interesting to try to find my place in this like medical matrix when I'm like totally on the inside, like super woo-woo. And
So what sign are you?
What sign am I? Oh, okay.
Ooh, I don't know now.
I'm a Leo. I'm a Leo sun. A Leo sun.
I knew it.
Yes. And I thought that's all there were. Like, okay, I'm just a Leo, I'm nothing else. But then when I started looking more into it, it's like, no, you have all these different parts of you that are different signs. And, it can just really help you understand yourself and your personality. And I found it personally very, very just helpful for me as a tool. It's just like one of the tools. But anytime I've read somebody's birth chart, like a friend or somebody, it's like totally spot on. And they're like, and I think it can be helpful to understand my clients better and how to help them, which is not always on key, but I'm kind of brainstorming of what I want to offer in terms of maybe some alternative type treatments as well, and just kind of focus on the psychedelic movement, and maybe some alternative stuff. And
yeah, you're hitting a lot of great stuff and still having that drive to learn new things and find new research and expand even more.
Yeah. My next move, I think, is going to be working with a psychiatrist here in Memphis, hopefully this summer, and create a ketamine program for her practice. I've been working virtually for 2 years, y'all, and I'm pretty Zoom burnt out from it.
Too many screens.
Too many screens, and I really miss the atmosphere and just working around people and working with people, and really feel like I could Teams message Mindbloom people, but I don't really know them, like it doesn't really feel like a real true work cohesive atmosphere, because it is remote. And I miss that. So I'm really looking forward to adding that in to my plate this summer. So we'll see.
There's no substitution for face-to-face. There's nothing like it.
No.
Yeah, Ryan, when you coming back down to Tennessee?
Early next month, I'll be in town for a couple days. So
yeah.
Definitely be grabbing a drink with you.
Yeah, we're gonna have some Eclipse whiskey.
Ooh, I'm looking.
Are you guys not drinking whiskey? I thought so. Like, I don't drink whiskey, but I drink tequila, and I totally have my tequila.
Hey, there we go.
I was ready for it. I thought you guys were
Holy
drinking.
Crap.
Oh, I was running behind, so I grabbed a hard cider today.
Okay, all right. Well, as long as you have a hard cider, then I don't feel as bad.
Oh, I'm always drinking. Don't worry. I work at a distillery. I'm encouraged to. I was trying out high-proof gin earlier.
Oh, nice. Okay, all right.
Ryan also has a dream life.
It's not bad. I get paid to drink things and talk to people and pour them drinks.
That's amazing.
And what if it works out?
Right? What if it works out?
That's for me so far.
Heck yeah, man. So I want to ask you one final question.
Okay.
What is one thing that novices in your field do wrong that drives you nuts?
God. Novices in my field of, I guess we'll say, psychiatry. I would have to say not recommending therapy, not requiring therapy, you know. I don't and I haven't always felt this way, but I don't think anybody should be on any psycholytic medications without having some kind of therapist. And I don't care if they say that they've tried to find a therapist and nobody, they don't connect with anybody or whatever, or they don't need it. You need it. You need some type, and there's different types of therapists, and there's a million of them, so you can try them. Because if you don't have that outlet, I mean, I just think it's way too important, and I think it should be required. But not up to me.
All right. Well, that sounds like great advice.
Yeah.
I do have
love
one
your
more
work.
quick question, if that's
Go
all
for it.
right.
Yeah.
Have you had to deal with any sort of stigma or anything like that towards ketamine or any of these psychoactive drugs?
100%. 100%. Because, ketamine, is that a horse tranquilizer? Is that a horse tranquilizer?
I like horses.
Right. I'm like, well, yeah, it is. Or, just be like, the only time I heard of it was Special K, back in the 70s or 80s. And, with the Matthew Perry stuff happening last year, that
Yeah.
definitely,
yeah.
all the headline people that just read the headline of things and they're like, oh my God, you work in ketamine therapy, like this killed somebody, that can bring up a lot of, and I just combat that with education, like there's nothing that you can really say whenever I'm like, well, no, like, let me just kind of explain, what's going on. But I do think there has been several stories about ketamine that have come out. And I find that very interesting, all the negative stories about it. But yeah, a lot of stigma, and a lot of times people will just like, even some of my family, they're just like, oh, okay, and I'm like, yeah, I work with ketamine, I do ketamine therapy. They're like, okay,
Still not sure about that yet.
They're like not asking questions, but they're like totally judging in their head. They're like, oh, okay.
Guarantee in 3 years you're all going to be, wow, this is great. I can't believe that you were one of the first ones before we even knew it. They'll be so proud.
Yes. And this, I think, really, I foresee this becoming a first line treatment eventually, and it should be, and it really should be. There is no sense in prescribing antidepressants for a lot of people. Now, some people need it, like really, truly, like OCD people are likely going to need some kind of antidepressant to get a hold of their thoughts. Maybe not with ketamine. It just depends on like schizophrenia. Like there's like certain levels where you're going to need some daily medication, but I think most of the time this is caused by trauma, and so we got to deal with the trauma, and the ketamine is a wonderful tool for that.
Well, I guess it would be a mistake if I didn't ask you what sort of like content stuff is going in your world, because I know like you talked about all the bad messages out there. How do you get like the good message out, or like market what you're doing, or share this kind of stuff?
Yeah, that's what I want to be doing, what I should be doing. I was listening to your guys' podcast and talking about how the perfection, like not posting until it's perfect, and during COVID, I took a break from social media for like a month or two, and ever since then, I just have a really hard time creating any content on there. I still have a lot of resistance to it for some reason, and I'm trying to work through it. But I know me personally through my private practice, like I am not doing enough with that, and I really want to get to the point where it doesn't feel so icky to do. And I guess just based on y'all's advice, I just got to do it and try it.
Yeah.
I just gotta start.
I'll send you a copy of that Stephen King book where he talks about writing, and it's like that line, like the only way to find your voice is to use your voice. So before you know exactly what you're supposed to be doing and what the perfect thing is, just do whatever comes out, because that's the only way you'll ever know.
I think I get overwhelmed with all the extra stuff. And I used to be super into the tech stuff and know all of the things about Instagram, and everything. And then once I got to my 30s and then just have been on the screen for so long, the last thing I want to do is look at the screen anymore,
Good point.
So that's where I'm at with that. But I know it's important. I know that it's coming. It's just, it's evolving in me personally, and trying to figure out where I land in that and how I want to Or
Well,
when
hey,
do
even
I
just
want to start?
being a great podcast guest and going on more shows like this help get you out that way. We
Yes.
can do the hard part for you and get a show put together. Just
Yeah.
get your name out there. Be a wonderful guest because you have been fantastic.
Oh, thank you so much. This
Yes.
has been fun, and I love this. Now, I'll do this and talk to people all day, but creating a Instagram reel, no. But
This is what
that
you're
mean,
strong at.
yeah, I need to get in contact with your friend clearly because I just need to get somebody to do this stuff for me.
Yeah. Like, let's definitely talk about this, afterwards. But, I'm so glad that you agreed to do this. This is something that's really important to me. And, you personally have, been a big help in my journey on all that stuff. But bringing your expertise and sharing your personal experiences and, not only just giving us an expert's walk through this, you really gave it this extra, detailed nuance that we couldn't get on our own.
Oh, thank you so much for having me. This has been so fun. I love talking about this.
Yeah. Well, keep in touch. Maybe we'll have you on someday if we have better questions to ask. 2 weeks, our next episode, we're actually going to be talking about making video content in vertical and the ways that actually helps you get even better at making your horizontal stuff. This is something that will help with how do we just make that quick stuff before we have time to think about it and, get to perfectionists and never make it. So looking forward to that.
Okay. Yeah, I'll check it out for sure.
Thanks again, Leah. I will put the links in the show notes of where we can, reach out to you if they have questions or they're interested in your clinic or your other work.
Amazing. Thank you so
Real
much,
quick,
guys.
does your clinic have a name that you want to shout out on here? Because we've just been calling it your clinic this whole time.
Yes. It's Transcendent Health.
Transcendent Health. Perfect.
Mm-hmm.
Great. Love it. I'll look it up too.